Today, the North Carolina Department of Health and Human Services reported just under 2,500 cases of COVID-19 today, a 3-month low. The downward trend in case numbers is also being seen here on campus.
After a spike in cases last week, the university reported 4 new cases today, bringing the total active case count to 79, with 224 students in quarantine.
And while testing continues to find new cases, the UK variant of COVID-19 is not far from Alamance County. It was traced back to cases in neighboring Guilford County and Mecklenburg County last week. We now have university physician Dr. Ginette Archinal live to talk about the variant and more on coronavirus at Elon. Dr. Archinal, thank you for joining us tonight.
Thank you for having me here.
So is the university working on the assumption that either the UK variant or the South African variant is already here on campus?
Absolutely. And in fact, it's not just the UK and the South African variants. There's also a Brazil variant. There's a new one that's been identified in California, and there's a couple of other more minor variants floating around. So we're assuming we've had some of these variants on campus since the end of last year.
And how concerned should students be about these variants on campus?
Actually, not horribly. The variant is just one aspect of the virus. The reality is that you protect yourself from these new variants the same way you protect yourself from the original virus. Wear a mask, physically distance, wash your hands, all the boring stuff that everybody's been doing all the way through. The significance of the variants is merely that it shows that this is a constantly changing virus, just like the flu virus constantly changes.
Yeah, and with the new required weekly testing this semester, are you at all concerned about students maybe letting their guard down because they are getting tested every week?
It's one of the things that I worry about a lot. I think it's very important that everybody remembers that a test is only as good as the moment it's done. It doesn't predict if you're going to be contagious 6 hours later. It doesn't predict whether you're going to catch the virus 4 hours later from somebody else. So having a test doesn't mean you don't need to mask. It doesn't mean it's okay to have a party. You know, if 10 people are all tested at 11:30 in the morning and all test negative, it doesn't mean you can then, you know, spend all afternoon in a restaurant laughing and joking and sitting next to each other and not wearing masks.
Within the Elon community, has there been any evidence that people who contracted the virus in the fall have been reinfected this semester or even over the winter term?
There certainly have been at least a couple of cases of which I'm aware of people who tested positive over the summer or in the late spring, and then tested positive again in the late fall and early winter. But that's not surprising.
And the CDC is now recommending that maybe wearing 2 masks is more effective than just one. Do you think people here at Elon should be double masking?
The really important thing about masking is an effective mask. So it doesn't really matter whether you single mask or double mask, so long as you wear it properly and it fits properly. It's all to do with how many layers of fabric there are between your mouth and nose and what you're breathing onto the person near you. So it's better to have a single well-fitting mask than 2 poorly fitting masks. It's really common sense when you think about it.
The CDC recently announced that those who are fully vaccinated are going to no longer need to quarantine if listed as a close contact. So first of all, is the university going to be following that policy?
Elon is following that policy. We have been waiting excitedly for it for the last month because we expected this to come out based on the data. And in consultation with our local health department, we will be following that policy. I think one of the things people need to realize about CDC guidelines is they are just guidelines. Any local health department can be more restrictive if it wishes to be. Fortunately, Alamance County are letting us not quarantine people who are fully vaccinated.
Dr. Archinal, thank you for joining us and for your insight tonight.